Good evening. TV3 News has learned that the Finance Minister, Brian Lenihan, has been diagnosed with cancer. Our political editor, Ursula Halligan, is at Government Buildings this evening. Ursula, how serious is this?
Sadly, Colette, it is very serious. You'll remember that just before Christmas, just on the last day of the Dáil, just before the Christmas, just before they broke up for the Christmas recess, that Brian Lenihan had to be suddenly taken into hospital for for a suspected hernia procedure. We all understood it was a minor procedure. It now turns out that the problem is much more serious than a hernia. TV3 understands that initial tests revealed that the minister is suffering from a malignant tumour, the precise location and severity of which will be assessed in the next few days as he undergoes more tests. Now, TV3 knew about this on Christmas Eve, but we held back announcing it out of respect and consideration for the minister, for his family, and for the fact that it is Christmas time. This afternoon, the Department of Finance has issued the following statement to TV3. It says, "The Minister is well and enjoying Christmas with his family. He does not propose to talk to the media about anything until the new year."
Ursula, this really is very shocking news.
Yes, Colette, this is very shocking news and sad news, especially for the Minister's family and especially coming at Christmas time. But it's also shocking news for members of the public. Brian Lenihan is regarded as one of the most popular members of the government. The people had a soft spot for Brian Lenihan. In fact, he's seen by many as being one of the most competent members of government. People like his upfront, affable manner. He isn't afraid of the media. He's a good communicator, and people tended to forgive him whenever he did make any mistakes. In fact, it seems like he's been Minister for Finance for ages now, but in fact it's only been for 18 months. But what a hectic 18 months it has been for him. In those 18 months he's had 3 budgets, the recapitalisation of the country's 2 big banks, nationalisation of Anglo-Irish, and then there was the bank deposit guarantee, and then on top of that there was the whole setting up of the NAMA scheme. So it's been an absolutely hectic 18 months for Brian Lenihan.
Ursula, is it too early to talk about the political consequences?
Yes, it is, Colette. It really is unclear politically what all this means. Obviously, it's a blow for Brian Cowen's government, but really it is far too early to talk about what this means or where it might go, because of course the minister continues to undergo further tests.
There we leave it. Well, TV3 News understands that the Minister has been diagnosed with pancreatic cancer. John Crown is a consultant in oncology at St Vincent's in Dublin. John, what does a diagnosis of pancreatic cancer mean?
Well, Colette, this is a very serious condition. It is a life-changing diagnosis, I'm afraid. Depending on what the stage of the disease is, a patient with early-stage disease, where it is confined to the pancreas, may be offered the option of radical surgery in an attempt to remove it completely and to effect cure. Now, that unfortunately is a little uncommon with this condition. Most patients are not candidates for surgery. The disease has spread a little bit. And under those circumstances, the aims of treatment are really more in the area of control, comfort, survival prolongation, rather than outright cure.
And John, how do you get pancreatic cancer?
Well, Colette, that's a great mystery in most cases. We have some hints about some risk factors, but for most patients who are afflicted with this disease, unfortunately, no readily identifiable factor is obvious. Certainly, smoking cigarettes is the single major thing which people can avoid, which increases the risk. And if you stop smoking within 10 years, your risk of getting the disease becomes much lower. So again, the message here, as in so many other areas, must be stop smoking. It's associated with middle-aged and elderly usually, although young people can get it. It can be associated with obesity and with certain other predisposing diseases like chronic inflammation of the pancreas.
John, what quality of life can you expect after a diagnosis with this cancer?
Well, again, Colette, it's very variable, and for somebody who has early stage disease who has the surgery clearly for several weeks or a month or two after the operation, they will be in a very definite recovery phase when they'll be dealing with the after effects of a truly very major operation. For other patients who unfortunately are not deemed to be suitable candidates for curative intent surgical removal, much of their quality of life at that stage will be dependent on the treatments they're getting. Obviously, some patients will be getting chemotherapy, which can have some side effects, although in truth the side effects of chemotherapy are much gentler than they used to be. They're much better controlled. And one of the things which used to be a real problem with pancreas cancer was chronic pain, and thankfully for the overwhelming majority of patients with pancreas cancer, the pain will now be very well controlled due to advances in palliative medicine.
John Crown, for now, there we leave it. Well, it's been a turbulent 18 months for the Minister, with 3 budgets, NAMA and other challenges to overcome.
When Brian Lenihan was appointed Finance Minister in May 2008, he joked about the timing of his elevation to such a tough job. He wasn't wrong. The following 18 months brought some of the greatest economic challenges the country has ever seen. In September that year, he made the shock announcement that the government was to guarantee the debts and deposits of the country's struggling banks.
The taxpayer has a vital interest in seeing that the bloodstream of our banking system is maintained.
As the public finances went into freefall, he was forced to bring forward his first budget to October. A new year failed to bring any new hope, with the banking crisis leading to the nationalisation of Anglo-Irish and the recapitalisation of AIB and Bank of Ireland. An emergency budget had to be held in April, followed by the establishment of the National Assets Management Agency. Unemployment continued to rise throughout the year as the government's tax take continued to fall. Cue Brian Lenihan's third and toughest budget. Cuts to social welfare and public sector pay sparked outrage, but despite the backlash, the minister managed to achieve €4 billion in savings.
Ceann Comhairle, the worst is over. The international economy has exited recession.
Few would disagree with Brian Lenihan's ability to tackle the many economic problems he's encountered over the past 18 months. The hope now is that these new challenges he's facing can also be overcome. Brian O'Donovan, TV3 News.
US airports are on high alert after a man tried to blow up a Northwest Airlines plane yesterday. A Nigerian man claiming to be an Al-Qaeda agent tried to detonate explosives strapped to his body as a flight from Amsterdam prepared to land at Detroit. The man was subdued by other passengers. And that's it for now. Good evening.